Good afternoon and welcome to the 2021 Annual General Meeting of the Brisbane South Primary Health Network. My name is Cindy Shannon and I'm the chair of this great organisation. I want to begin by acknowledging the traditional custodians of the land on which we live and work and of the many different nations across the greater Brisbane South region. We pay our respects to the elders past and present and emerging as the holders of the memories, the tradition, the culture and the spiritual well-being of Aboriginal and Torres Strait Islander peoples across our nation. We acknowledge any sorry business that may be affecting the communities as a whole. In the spirit of reconciliation, partnership and mutual respect, we continue to work together with our Aboriginal and Torres Strait Islander partners to shape a health system which responds to the needs and aspirations of our community. So the agenda for today's meeting will be displayed on the screen. The formal business will be dealt with in this members only part of the AGM, and at 3 p.m. we will have our public session of the AGM and presentations and keynote speakers. The AGM will conclude at approximately 4 p.m. So I just want to go through a couple of housekeeping issues. Could you please use the raise hand function or chat function on the toolbar at the right-hand side at the top of the computer if you'd like to ask any questions or make any comments. So now I'd like to begin the formal business of the AGM. This meeting has been called to note the minutes of last year's annual general meeting, receive the audited financial statements and announce the results of voting on two important decisions, being the approval of the AGM minutes and one new director election. As a quorum has been met by those present and by valid proxies, I now declare the AGM open. All valid proxies have been received within the prescribed time limits and have been admitted. The total number of votes submitted in advance of the meeting for each item of business have been counted and will be recorded in the minutes. So the information about the apologies received from members and the quorum required is tabled on the next slide here. I can confirm that 8 valid proxies were received, and I encourage members present to ask questions about or make comments on the items of business and resolutions during this meeting. I refer to the notice of meeting for our AGM, which sets out the resolutions proposed for the meeting. No notice of other business has been received in accordance with the Corporations Act, so only the items of business to come before the meeting today will be those specified in the notice of meeting. I propose to proceed on the basis that the notice of meeting has been read. So the next item is to note the minutes of the 2020 Annual General Meeting as tabled. As no resolution was required, there's no voting on this item of business. The second item of business is to receive and consider the annual financial report of the company together with the director's report and the auditor's report. I note that Nino DeMarco, our chair of our Finance, Audit and Risk Committee, is unfortunately a late and unexpected apology for today's meeting. So I will make a few brief comments on Nino's behalf and just point out that members would have received the financial statements with the notice of meeting, and there are a few items that I'd just like to highlight. During the FY21 year, revenue increased by about 6% increase. There's been a positive growth in funding from federal to state governments. The interest has reduced slightly, largely because of reduced interest rates. Our expenses and operational costs have been contained, with a higher proportion going to the commissioning of services. We're in a very sound cash position. Our surplus for FY21 was $218,000, and this contributed to the organisation's total equity increasing by 12% from last year. The divisional reserve was incorporated into retained earnings, and this is delivered in note 17 in the financial statements. So they're just a few of the key points that Nino asked me to highlight for you, and no resolution is required so there's no voting on this item of business. But I do note that the company's auditor is available online to answer questions relevant to the conduct of the audit and the preparation of the report. If there are any questions in relation to the financial report and the reports of the directors and auditors, I ask you to place those now. I'm not seeing any hands coming up or any questions, so we will now take the financial statements as read and accepted. For our ordinary business of the AGM, I will be announcing the results of voting to approve the minutes of the extraordinary general meeting held in September and the election of one new director. These items were proposed as ordinary resolutions as set out in the notice of meeting. Each ordinary resolution required more than 50% of member votes to be in favour of the resolution in order for it to be passed. So item 3 is the approval of the draft minutes of the extraordinary general meeting that was held on the 14th of September 2021. I'll take these minutes as tabled and included in the notice of meeting. I also note that Professor Claire Jackson, who chairs our nominations committee, chaired the AGM as I had declared a conflict of interest, and in order to manage that, she chaired it and led the business to the members that day. This item of business relates to members approving the minutes of that meeting as a true and correct record. Members were requested to approve those minutes by returning voting papers to the company secretary before this AGM. The terms of the resolution are shown on the screen, together with a breakdown of the votes received. More than 50% of members have approved the minutes of the AGM as a true and correct record of that meeting, and accordingly, I will ask Professor Claire Jackson, who chaired that meeting, to sign the minutes. So before I move on to the final item of this part of the meeting and the formal business, which is that of the election of one new director to the board. I also note that the board has a succession plan in place and will be prioritising the replacement of the remaining board vacancies in two. We will rigorous and strategic recruitment process. Our ongoing commitment to diversity and inclusion on the board will remain at the forefront of our thinking, and we look to appoint the next generation of directors, as well as supporting those who are on a path to leadership and are being on the board of this organisation. We'll also be farewelling 3 of our board directors this year. Dr. John Kastrisios, secondly, Dr. Neil Carrington, and thirdly, Ms. Cheryl Herbert, who I will discuss a little bit later in this meeting. So I want to now move to item 4, which is the election of a new director. Fiona Evans has been nominated by the Nominations Committee and offers herself for election to the board. The board supports her election. Fiona is a very experienced and capable director. She's held in very high regard by the board, and details of her experience and qualifications were set out in the notice of meeting for that went out in advance of the AGM. Members were requested to vote on the motion by returning voting papers to the company secretary before the AGM. The terms of the resolution are shown on the screen, together with a breakdown of the votes received. As more than 50% of votes were in favour of the motion, I declare the motion carried. I'd also very warmly like to congratulate Fiona and welcome her to the board. The public session of our AGM will commence shortly with a number of presentations and keynote speakers. Please remain online as the public session will automatically commence at 3 p.m. Please use the conversation function to ask questions, and this will be monitored throughout the meeting so that we can answer your questions. Our thanks for accommodating this online format once again. On behalf of the board and the staff of Brisbane South Primary Health Network, I'd like to thank everybody for attending this members' formal business part of our AGM and for your ongoing support this year. Thank you, and we'll be back shortly. Good afternoon again and welcome to Brisbane South PHN's 2021 Annual General Meeting. I'd like to welcome the board, member organisations, community organisations, health system partners, our clinical and community council advisory members, our staff and members of the communities in which we serve. We're so glad that you've been able to join us today. I'd also like to very warmly welcome a great friend and colleague of mine, Haylene Grogan, the first ever Queensland Chief Aboriginal and Torres Strait Islander Health Officer, who will be our guest speaker today and will be introduced in a little while. I want to also acknowledge that we're on Yagara country and pay my respects to their elders past and present, and also to pay my respects and extend those to any Indigenous people either in the room with me today or who have joined us online today. And it's really fitting to acknowledge that a major focus of our meeting today will be on Aboriginal and Torres Strait Islander health, and hearing from Haylene will be a really important discussion for us to then continue. We will do our best to keep within the 1 hour for this session, and please use the hand function or chat function if you want to ask questions or make comments during this session. So without any further ado, I'll get started with my report. I want to begin by acknowledging the 3 directors who've stood down from the board this year. Firstly, Dr. John Kastrusios, who stepped down in June this year. John has been a very long-standing member of the board through various iterations, from the Division of General Practice through Medicare Local Days and now to the Primary Health Network. He's a well-known local general practitioner and he's served in many roles on this board. He's a previous chair, he chaired the Clinical Advisory Council, and he has also served on a number of the board subcommittees. I also want to acknowledge Cheryl Herbert, who is a very long-standing friend of the PHN, and during her tenure this time on the board, Cheryl has served as the chair of the Community Advisory Council. And I also want to acknowledge Dr. Neil Carrington, who also finishes with us today. Neil has very ably chaired the Governance, People and Culture Committee, and I want to thank all for their efforts and their commitment to the organisation. I also, on behalf of the board and the staff, want to wish you the very best going forward and hope that you will continue to remain good friends of the Brisbane South Primary Health Network. I'm also both happy and sad to advise that our Deputy CEO, Lucille Chalmers, will be leaving us, but she'll be leaving us to take up a very important new role as CEO of Darling Downs and West Moreton Primary Health Network. Lucille joined us in 2017 as our General Manager of Commissioned Programs, and she was then appointed Deputy CEO in 2020. Her contribution to the organisation during her tenure has been immense, including the development of nationally recognised programs such as our recognised Respond and Refer Domestic Violence program. That's just one of many. Our loss is, however, Darling Downs' gain, and I think we're delighted that Lucille will be staying within the Primary Health Network family, and I think we're also reflecting on the fact that we are a breeding ground for such great talent. So it's testament to the leadership and support that is provided to staff here. So we wish you all the best in the future, Lucille, and we will be sorry to see you leaving next week, but very much looking forward to see you go from strength to strength in your new role. My thanks also go to my fellow board members for their service, focus and positive approach this year. There is indeed much to be optimistic about, and I know we're all looking forward to what lies ahead in 2022 after a very big and somewhat tiring year. Our CEO, Mike Bosel, will soon share the year's achievements, challenges and opportunities. He will discuss the critical relationships that power and sustain our success. Even as a summary, it's an impressive list, so I want to take a moment to recognise the team at Brisbane South Primary Health Network. They've kept their focus on the complex and interlinked needs of our region. They've watched and worked very hard in the face of very demanding and changing environments in the last 12 months. They have adapted in response to every challenge that has come their way, particularly in relation to COVID-19 and the rollout of the vaccine and the further disruptions that have happened with the refurbishment of the office. So the board and I want to express our sincere thanks to the staff. We're immensely proud of the results that have been achieved in 2021 and work that has truly put people at the heart of healthcare. Thank you all for your innovation, perseverance and positivity, and most of all, commitment to Brisbane South and its people. It's a special place to work, and that is a testament to all of you. As always, we recognise that our work is only possible through our strong relationships with member organisations and those who work at the community interface and coalface. It is this shared commitment to the region that makes our work possible. On behalf of the Board of Brisbane South Primary Health Network, I thank you all for your continued participation, support and collaboration. I now invite our CEO, Mike Bosel, to share his reflections on the past year. Thank you very much, and over to you, Mike.
Thank you. I'd like to take this opportunity to briefly acknowledge the traditional owners on the land on which we are meeting today and to pay my respects to elders past, present and emerging. My thanks to you, Chair, for your reflections on another busy year, and my personal thanks to you and the board for your continued support and guidance as we partner to deliver high quality, agile and person-centred care to those who need it most. I thought that 2020 was going to be hard to top, but 2021 has taken it to the next level, both in terms of the challenges and the opportunities that have come our way. It's a hard one to sum up in the time that we have, so we've taken the liberty of making a short animation that I'd like to share with you now for the first time.
In 2021, there was no such thing as business as usual. The COVID-19 pandemic threw new and even more complex challenges our way as we worked in partnership with primary care providers, Metro South Health, Queensland Health and the Australian Government to get everyone in our region vaccinated as quickly and safely as possible. We made sure that aged care residents and staff were offered protection through a comprehensive vaccination program and equipped and supported general practices to join the front line of the rollout, delivering the rapid scale-up necessary to protect our community. We also went the extra mile to ensure that the most vulnerable and hard to reach in our region were supported to get vaccinated. The last few years have brought opportunities for learning and innovation. We applied what we've learned to our new strategic plan, which sets out our vision to deliver the best possible health and well-being for every person in the Brisbane South region. We'll get this done by putting people at the heart of healthcare, prioritising those with the greatest need, valuing the strength of community, learning, adapting and innovating, and partnering to deliver meaningful change and sustainable results. As part of this, we've modernised the way we engage and support the primary care sector, delivering an integrated and valued service to those who serve our community. We also took the time to really understand the needs of our region, completing a comprehensive health needs assessment that will guide our priorities, plans and investment. Being serious about health system reform means we are serious about listening. Thanks for playing your part in helping us better understand the big issues we face. This year, we also harness technology to make people's lives easier when they're most at risk. Our Emergency Choices website gives people effective alternatives to the emergency department when they're sick or injured after hours. The rollout of the new e-prescription service has also meant that patients can have their medicines dispensed at almost any pharmacy across the region using a simple QR code text message sent to their phone by their GP, saving time for healthcare providers and helping people get the medications they need when they need them. In everything we do, we are partnering to build a health and wellbeing system in which every person in the Brisbane South region, especially those with the greatest need, is supported to live well and experiences care that is connected, high quality and easy to access. Our partnerships with the region's diverse communities lie at the heart of this work. In 2021, we worked closely with our First Nations, Asian and Maori and Pacifica communities on the health issues that affect their lives. We also developed a new diversity and inclusion framework that is shaping our organisational culture and our ways of working. We're committed to recognising and embracing all that makes us different and celebrating our diversity as a strength. Last, but by no means least, we paid special attention to the youngest members of our community through our Thriving and On Track program that provides early identification and support services for children experiencing developmental issues. More than 1,500 children across 80 daycare centres in Logan and Inala have participated in this program so far, building better futures through early intervention. We're proud to have delivered meaningful change for communities in our region this year, and even prouder of the healthcare providers who have selflessly delivered exceptional service and care against a backdrop of complexity and competing priorities. Thank you for working with us to put people at the heart of healthcare.
It's been quite the year, and we approach 2022 with genuine optimism about what lies ahead. Our new strategic plan directly addresses health inequities and inequalities and draws on the power of partnerships to support the best possible health and wellbeing outcomes for every person in our region. It allows us to be flexible and innovative as we identify and make the most of these emerging opportunities. Our strategy also reflects our maturing role and contribution to state and federal systems. We are proud to support positive, sustainable shifts in the health and wellbeing of our communities. Above all, our strategy maintains the focus on the people that we serve. Our analysis, planning and implementation is built on meaningful and measurable engagement, partnership and collaboration with the people of Brisbane South. For me personally, our strategy speaks to accountability, transparency and impact, getting the right care to those who need it most through effective and diverse partnerships. Today, I'd like to share a few examples that truly embody our aspirations. At last year's AGM, we focused on the issue on family and domestic violence, showcasing our Recognise, Respond, Refer program and hearing about the devastating human impact of family violence from our keynote speaker. At that time, Recognise, Respond, Refer was a relatively new program that we had developed for our region, but we knew it worked. We knew it was changing lives, and we knew it was worth sharing. Today, I'm proud to advise that since we last met, Brisbane South PHN has played a critical and crucial role in shaping primary health response to domestic and family violence, not just in our region, but right across the country. A federal parliamentary inquiry into family, domestic and sexual violence in Australia concluded in March of this year, with the inquiry report making 88 recommendations to inform development of the next national plan to reduce violence against women and their children. The report recommended the Australian government leverage primary health networks' ability to improve the identification and response to family, domestic and sexual violence in general practices. It also particularly noted the success of our program in the Recognise, Respond, Refer and recommended that it be rolled out nationwide. A real and significant endorsement of this program, of which we are so proud. My congratulations to the team that has worked tirelessly to make this program a success, and my sincere thanks to all the health workers in the region who have embraced Recognise, Respond, Refer and changed lives while doing so. I really can't wait to see the next phase of its development. Our region includes some of the most vulnerable communities in Australia. In Logan, there are 3 communities where 100% of the population are living in the most disadvantaged quintile of the Australian population. Brisbane South's Thriving and On Track program helps at-risk children and their families get the help they need to have the best start in life, wherever they live. We are working with health education community partners to collectively improve health and education outcomes of the children in our region. The program's outcomes speak for themselves. Over 1,000 local children have been supported to access health and development support, getting them ready for school, learning, and a lifetime of opportunities. We're now sharing these learnings with federal government, especially as they develop a 10-year framework to protect and support the next generation of Australian children. We also work closely with the state government and are exploring ways to maximise the impact of our TOTS program across the region and beyond. As we mature as a PHN, our role as system innovators and reformers is also developing. Brisbane South PHN is leading a new way of working for PHNs, increasing our collaboration with the state government and expanding our scope to improve the health and wellbeing of people in Brisbane South. The partnerships that we have formed through our response to COVID-19 will continue and evolve to support collaborative community and place-based responses across our region. We have worked hard to position ourselves as trusted partners of both the state and federal governments, and our success in this area is just starting to be borne out. This work will continue over the next 12 months, and we look forward to delivering even more for the people of Brisbane South. As always, we can't do what we do without our partners. Effective system reform is built on effective partnerships, and we remain committed to convening, listening, and collaborating with our system partners and communities to reform the health system and leverage our respective strengths. Deepening our relationships with our member organisations and other peak bodies is a particular focus going into 2022. We know that we are stronger together, and we are committed to providing mutual value. My sincere thanks to our health system partners and the primary health workforce, community groups and organisations working at the interface of community and health. My thanks also to our clinical and advisory council members who provide such a vital link to our stakeholders. We have recently refreshed our membership, and as part of the process, we have been overwhelmed by the quality and diversity of applicants who are willing to share both their expertise and insight with us. Last, but by no means least, I want to thank our staff. As a not-for-profit entity, we are a relatively small team tasked with an immense responsibility and remit. You are all doing a phenomenal job of delivering sustained results in a fluid environment, and your commitment to equity, innovation, and meaningful community engagement is apparent in everything you do. It's been a tough and tiring year, but you've never lost sight of our purpose. The board and I look forward to supporting you as we continue our journey towards better health for our region. So with no further ado, we'll move to our focus presentations. The remainder of our session focuses on the topic of First Nations health. At Brisbane South PHN, we work every day to improve the health outcomes of individuals and families in our region's communities by providing a more accessible and equitable health system. And nowhere is the question of inequity more apparent than in the challenges faced by our First Nations communities. The gap in life expectancy for Aboriginal and Torres Strait Islander populations compared to that of broader Australian populations remains a national shame. The Aboriginal and Torres Strait Islander youth suicide rate is 4 times that of other Australian youth. The burden of chronic illnesses such as diabetes and rheumatic heart disease is 2.3 times greater in First Nations peoples. And Australia remains the only developed Western nation that has failed to limit trachoma, a preventable cause of blindness. Our recent health needs assessment has shown a spotlight on the specific needs of First Nations peoples in our region, and the message is clear. While much progress has been made, we still have considerable work to do. In partnership with the remarkable First Nations health and community organisations of our region, we hope to achieve that. Today's focus topic will examine progress to date, as well as the scale of the task ahead, and the many opportunities that exist to permanently change the narrative around First Nations health. I am so grateful to all the speakers you will hear from today for taking the time and the trouble to share their insights with us today on this critical issue. It is now my great honour to read out a message from the Honourable Ken Wyatt, the Minister for Indigenous Australians, who's been kind enough to share his insights on the national context for this issue. His statement reads as follows. Thank you for inviting me to address your annual general meeting. I apologise that I'm not able to attend in person. I'd like to start by acknowledging the traditional owners of the lands and waters across Australia and pay my respects to elders who have led the way and to our young ones as they become the leaders of tomorrow. I also acknowledge the strong commitment of the Brisbane South Primary Health Network to the health and wellbeing of the Aboriginal and Torres Strait Islander community. The Morrison government committed record funding to health in 21-22 budget, with a total spending of over $124 billion across health, aged care, sport and recreation. This sum also includes more than $780 million to deliver greater access to health services for Aboriginal and Torres Strait Islander peoples. And in the interest of time, the detail of this spending is available on our website. The 21-22 budget also included measures that support improved health services in rural and remote areas that will benefit Indigenous communities. Health spending will equate to $98.3 billion in 21-22. This is an increase of 4% over last year. And on top of this, we have committed more than $31.5 billion as part of the COVID-19 response. The Brisbane South Primary Health Network is critical to the people in the region. GPs, nurses, allied health professionals, pharmacists, dentists, and Aboriginal and Torres Strait Islander health workers and practitioners will meet the majority of health needs throughout a person's life. General practice is the entry to the health system for most Australians. So it is essential that all GPs provide a culturally safe, respectful, and understanding service for Indigenous Australians. Programs like the Integrated Team Care Schedule are helping to achieve this by upskilling GPs in cultural awareness and making culturally appropriate primary health care, health information, and care coordination more accessible to our Indigenous community. The value of embedding Indigenous knowledge and culture in service delivery cannot be overstated. It is an important tool in addressing inequities in health outcomes for Indigenous Australians. The Aboriginal and Torres Strait Islander concept of health extends beyond physical health and well-being to include the social, emotional, and cultural well-being of individuals, families, and communities throughout their whole life. Health services that are prevention-focused, responsive, culturally safe, trauma-informed, and free of racism are pivotal. To this end, increasing the employment, training, and leadership of Indigenous Australians across the health and wellbeing sector is crucial. In August this year, the Morrison government released the Commonwealth's first implementation plan for the National Agreement on Closing the Gap, and with it committed more than $1 billion in new measures to help achieve the Closing the Gap outcomes. Our Closing the Gap investment includes funding of $254 million over 4 years to fund repairs, reconstruction, and enhancement of health infrastructure in the Aboriginal community control sector. This funding will deliver new and renovated health clinics and associated housing for health professionals. $66 million over 4 years was announced for expanded Indigenous alcohol and other drugs, treatment services, repairs for aging Indigenous AOD residential rehabilitation, infrastructure, and employment opportunities. In addition, $45 million over 4 years was announced for the Healthy Mum's Healthy Bubs package to support delivery of primary health care, including maternal and antenatal care services for mothers of Aboriginal and Torres Strait Islander babies. Principally, the National Agreement commits all Australian governments to changing how we work with Aboriginal and Torres Strait Islander people communities. It recognises that achieving the aspiration of Indigenous Australians can only be done when we work in genuine partnership and shared decision-making on policies and programs. A focus on local solutions designed and led by communities is key here, and I'd like to acknowledge the work that Brisbane South PHN is already doing in partnership with your local Aboriginal and Torres Strait Islander community control organisations. For example, your work to support the Institute of Urban Indigenous Health and Galang Place Aboriginal and Torres Strait Islander Corporation to provide essential mental health, alcohol and other drug treatment and suicide prevention services at no cost to Aboriginal and Torres Strait Islander peoples. I also understand that the Gift of Galang program, delivered by Inala Wangara Inc., has been highly successful, which has sought to improve the well-being of Aboriginal and Torres Strait Islander children at Inala Primary School through a program aimed at strengthening connection to culture. These programs are Aboriginal-led and place culture at the heart and at the centre of health. These programs are also critical given that the Aboriginal and Torres Strait Islander peoples experience suicide at a rate more than twice as high as that of any other Australians. The Morrison government also remains focused on the needs of older Australians, particularly as the country deals with the impacts of COVID-19. As we know, Indigenous Australians experience a disproportionate level of illness and disability and are more likely to have complex healthcare needs at a younger age. We also know that Aboriginal and Torres Strait Islander elders are the backbones of their communities. Primary health networks play an important and ongoing role in supporting their need and help to navigate the health system and providing culturally responsive, integrated healthcare. I would like to thank you all for the work that you do to make the people of Brisbane South region healthy and strong. I recognise the enormous effort of your organisation and all those working in the health and caring sectors over the last 2 years to keep the community safe and vaccinated during the COVID-19 pandemic. Thank you. The Honourable Ken Wyatt, AM, MP, Minister for Indigenous Australians. I now would like to invite Helen Grogan, the Queensland Government's Chief Aboriginal and Torres Strait Islander Health Officer and a great friend of Brisbane South PHN, to share her insights on the local context for this issue. Welcome, Helen.
Thank you, Mike, for inviting me to give the keynote address to Brisbane South's AGM, and thank you, Brisbane South PHN AGM, and thank you also, Cindy Shannon, as the chairperson, for inviting me for this opportunity. To start, I'd like to acknowledge the cultural custodians of country we are on today across the state, where each and every one of you might be, and acknowledge the cultural lands from which everyone is joining us online. I'd like to pay my respects to elders past and present, and in particular, thank my elders who have given me the opportunities I have today, and I get that opportunity every day to say that. In particular, I'll take this opportunity to thank Cindy Shannon again for her support she's afforded me over the years in my career development. And as a proud chairperson of the Brisbane PHN, it's a privilege to have the honour of talking here today. I stand on the shoulders of my elders and ancestors who have come before me, and I take my responsibility as the inaugural Chief Aboriginal and Torres Strait Islander Health Officer in Queensland very seriously. It is both an honour and an incredible privilege. I'm really happy to see the focus of your AGM this year is about enduring commitment to First Nations health. I like that word, enduring, because it has connotations about shared history, shared future, and how we're going to get there together. Enduring means steadfast, and this is what we need, a steadfast commitment to working together to achieve health equity for First Nations people. And I encourage everyone here online today to turn their enduring commitment into equity in action. Because as well as talking about health equity, and we do need to talk about these ideas again and again and again, we also have to translate these ideas into practice. For my keynote address, I'm going to talk about health equity reform agenda, the recent release of our health equity framework, Making Tracks Together, in October this year, and the role of PHNs in this important reform agenda. The last part I can answer very easily and quickly, and that is PHNs have an absolute integral role to play in driving health equity reforms across the primary healthcare sector in partnership with the Aboriginal and Torres Strait Islander community controlled health sector in Queensland. All of us working in the health system need to exercise our leadership, because the heavy lifting can't be done by any one part of the health system. First Nations voices need to be front and centre driving these reforms, but we need partners and allies in our reform journey, and PHNs are a key partner and ally, as Mike just highlighted. We all know our health system in Australia is very complex and complicated. The states and Australian government have different but some shared overlapping responsibility. Some of our funding instruments are a bit blunt and perversely seem to incentivise hospital activity over maintaining good primary health care. We have various public and private providers delivering care in numerous settings, and consumers and patients can exercise some degree of choice in their healthcare depending on their circumstance and agency. This complexity means our health equity reform agenda needs all aspects of the health system, from primary healthcare right through to specialist tertiary care, placing equity at the heart of everything we do. And I know we can do this because we've been doing it for nearly 2 years in our response to COVID-19. Living through a pandemic and still living through this pandemic and working in the health system has shown all of us how we can be agile and responsive. The health system can partner, pivot, scale up, scale down, and tailor our approaches when lives depend upon it. We are seeing this now in our current efforts to close the vaccination gap between First Nations people and other Queenslanders by delivering local tailored approaches. In many parts of the state, we're door knocking in terms of to increase our vaccination rates. Queensland Health is working in partnership with other health providers, including the Aboriginal and Torres Strait Islander community controlled health organisations, our PHNs, our local community leaders, elders, sports people, and mayors to develop local approaches to address vaccine hesitancy and hard to reach pockets of our community. We've established multidisciplinary clinical teams across providers and supported local incentives to elevate the voices of local champions. This is an example of health equity in action, and we need to do more of it when we transition to whatever our new COVID norm is going to look like. A lot of people ask me if health equity is just another way to describe patient-centred care. So if it is Isn't that what we do now? Do we really need to do anything different? It's a good question, and I'm still refining how I answer it. In a nutshell, patient-centred care is what the system tries to deliver for all patients, whether you are black, brown or white, female or male, gay or straight, wealthy or poor, English speaking or not, educated or uneducated, urban-based or living in a remote community. And having been a Aboriginal and Torres Strait Islander health worker, my first job in my health career, as well as a clinically trained registered nurse and midwife, I can say that delivering tailored clinical care to treat and manage health conditions has always been part of our health professions. But what the health system hasn't done well, which can be attributed to many historical, social and cultural reasons, is delivering equitable care that takes into account what each person needs to attain their full health potential and live long and healthy life. Equitable care requires embedding a social justice and human rights approach within patient-centred care, because different population groups have different levels of advantage and agency, and therefore require different approaches and resources to live long and healthy lives. Treating everyone the same way when they are not isn't equitable. And for First Nations people, being colourblind is a form of racism because it denies our cultural differences. Effective care requires an agile and responsive health system that has a capability to cater for those differences, not because it's an optional extra or a nice thing to do. The delivery of effective, efficient and appropriate care depends on us catering for those differences. And as a proud Yalanji and Tagalaka woman with Italian heritage, I can say without reservation or hesitation that our health system can be more responsive to First Nations people, as we still experience many forms of racism. I know this personally from my own experiences and from those of my family and professionally working nearly 40 years in government. And year after year, our data continues to confirm this. Going back to the release of our landmark National Aboriginal Health Strategy over 30 years ago in 1989. Equitable healthcare is both culturally and clinically safe, which is yet to be the norm. So when I talk about health equity, I'm talking about designing and delivering healthcare that First Nations people need and want to reach their full health potential with First Nations people. I'm talking about seeing more First Nations people working in the health system, from gardeners to surgeons. I'm talking about listening and responding to the voices of First Nations people, including consumers, community members, elders, and our workforces. And I'm talking about creating a better integrated and coordinated health system so no one falls through the gaps. That is what health equity means to me in principle and practice. Our people in the system, our voices in the system, and a better coordinated system. And these ideas and many others expressed by our First Nations leaders across the health system and the state are driving our health equity reform agenda. I will now pivot for the remainder of my time to dive into health equity legislative amendments that were recently passed to show how we are translating those ideas into action. It is important to highlight that Queensland is the only jurisdiction to have legislated the achievement of health equity and the elimination of racism in the law governing our public health system. I'm very proud of this because in my bag, every day of my life, I carry the certificates of exemption my father and auntie had to carry on them to get access to Australian society and denounce their Aboriginality. This was the law during my family's lifetime, so it is difficult to express in words just how important it is to have legislation that both recognises the cultural rights of First Nations people and requires a public health system to actively eliminate racism to achieve health equity. It is the very reason I've decided to join and pursue a career in government, was to work at changing those laws that ruled my parents' lives. I trust many people at the AGM already have working knowledge of the changes to the legislation, but I'll try and summarise some of the prominent elements for today. The first element of the legislation is a requirement for all hospital and health services to have at least one Aboriginal and Torres Strait Islander board member. I'm pleased to say even before this legislation was amended in 2020, every HHS, that's hospital and health service, had First Nations board members. As of today, I've reported that we now have 21 First Nations board members across the state, including a board chairperson for the Torres and Cape HHS. This equates to 15% of all HHS board members across Queensland. I look forward to the day that when we double that, and 30%, maybe even more of our board members are First Nations, and I hope to see it in my lifetime, because seeing First Nations faces and listening to First Nations voices at the highest governance and leadership tables of HHSs will go a long way towards eliminating racism. The second element is a legislative change requiring each HHS to develop and implement a First Nations health equity strategy. These amendments were passed in August last year, and in this year, the supporting regulation was passed in April. After a comprehensive statewide consultation process and accompanying policy framework, Making Tracks Together was released in October this year to explain the changes to the legislation in everyday policy language. What is unique about the health equity strategies is that Aboriginal and Torres Strait Islander people's involvement is now mandated. It's not optional or preferred, but a requirement of the law for First Nations consumers, native titles, primary healthcare providers and staff members to be development stakeholders in the redesign of their local health system. Our current Health Minister, who was the former Attorney General, described this as codifying the voices of First Nations people in legislation. And it is an extraordinary and historic step by valuing the diverse voices of Aboriginal and Torres Strait Islander peoples, not just a select few. PHN's primary health care networks are also identified as service delivery stakeholders in that legislation, because integrating and coordinating care across the continuum from primary through to specialist care and then back to primary care is an ongoing challenge. Navigating the health system is difficult for everyone, but especially for First Nations people who distrust the health system and often opt out from accessing any care because they become very sick before they are admitted to hospital. Our current COVID-19 vaccination hesitancy shows this clearly. The distrust in the health system and government in general runs very deep. This is why tailored First Nations pathways into primary health care and across the health system is needed urgently. These pathways were needed before COVID-19 came along, but the pandemic has highlighted once again the health inequities that we have gotten used to in Australia. I understand how all of us got caught up in the daily churn of our current 8-year life expectancy gap that demonstrates clearly health system isn't working for our mob and that it needs to adapt and change to be both clinically and culturally safe. The health system, of course, can't address all the social determinants of health. We all know this, but more can be done across the health system in partnership with the other sectors. And again, this requirement is reflected in our supporting regulations of the recent changes to our legislation. Whilst our legislation only applies to Queensland Health and the public health system, we intentionally created hooks in the legislation to mandate partnership with other providers, including PHNs. Queensland Health is a key player in the health system, but we need our entire health system to genuinely deliver patient-centred and equitable care. And this, in a nutshell, is what the new health equity strategy is all about. Redesigning, reshaping and reforming local health systems with First Nations people based on what First Nations people need and want to reach their full potential of health. And PHNs are critical partners and allies in this reform journey. Thank you for giving me the opportunity to address you today. I hope some of what I've said resonates and everyone can see themselves playing a role in the reform agenda. All of the information about the reforms on the website, and I also encourage anyone in the PHN to reach out to my team to talk further about the reforms. Our journey towards health equity is a long one, but I genuinely believe we're making the right tracks because we're now travelling together. And I hope that all of us look back in 2031 and know that we've actually laid the foundation in Queensland and made a difference to closing the gap for our mob. Thank you.
Thank you, Haylene. And again, can I just express our thanks for your keynote speech. Not only was it transparent and honest, it was full of emotion. And I know as we continue our journey in addressing the inequities of Indigenous health, that you will be a partner, a supporter, but you will also hold us to account where we're not able to provide that resources and that work that we need to do. As many of you will know, our region is home to Australia's largest urban population of Aboriginal and Torres Strait Islander peoples. We want every First Nations person in our region to have easy access to holistic, culturally safe and evidence-based health services to support optimal health, development and wellbeing across all stages of life. I'd now like to welcome Brisbane South PHN staff, Nairi Mewett and Alice Clements, who will be discussing the ways in which we are working together to deliver on this vision.
Kia ora koutou, my name is Alice and I'm the General Manager of Stakeholder Engagement and Communications at Brisbane South PHN. I also have the privilege of chairing our Diversity and Inclusion Working Group, which has our ongoing work to support First Nations peoples from our region at its core. At Brisbane South PHN, we work to support First Nations peoples to enjoy long, healthy lives that are centred in culture, with access to services that are strengths-based, prevention-focused, responsive, culturally safe, and free of racism and inequity. We recognise that there's still much work to do and that we have a long journey ahead of us until we have achieved equality and health outcomes for First Nations peoples. It's my great pleasure today to introduce Nairi Mewett, a Nunakal woman from Minjerribah, who's the Aboriginal and Torres Strait Islander Programs Manager here at Brisbane South PHN. Today we're going to have a yarn about the work that Nairi is leading to deliver on this vision. You're Nairi.
You're Alice. Thank you.
Nairi, I know that much of our work in this space is shaped around the 5 dimensions of reconciliation that Reconciliation in Australia works to. These dimensions are race relations, equity and equality, institutional integrity, unity, and historical acceptance. These 5 dimensions guide our organisation's Reconciliation Action Plan and provide the lens through which we commission programs and initiatives to improve First Nations health outcomes. The vision outlined under race relations is for all Australians to understand and value Aboriginal and Torres Strait Islander and non-Indigenous cultures, rights, experiences, resulting in stronger relationships free from racism. These are relationships based on trust and respect. Nairi, are you able to tell us a little about the ways that we're delivering on our commitment to race relations through our work?
Yes, so I had the privilege of arranging our first gathering with elders and Aboriginal and Torres Strait Islander service providers in the region, and we came together at the Glen at the beginning of this year, and it was really interesting to see all the people in the room having the same feedback. So it was identified that we had an area of poverty, trauma, addiction, house shortage, poor education outcomes, unemployment, and a lack of social service supports in the community. So it was great to see the feedback from all areas and the areas that we need to address. So that's something within our health needs assessment, which has also followed through and identifying the same areas. So which gives us a great outlook to see how we can move forward and supporting my community, and gives us a good baseline of what areas we need to focus on.
Nairi, I know that much of our work in this space is shaped around Reconciliation Australia's 5 dimensions of reconciliation, which covers off race relations, equity and equality, institutional integrity, unity, and historical acceptance. These 5 dimensions guide our organisation's Reconciliation Action Plan and provide the lens through which we commission programs and initiatives to improve First Nations health outcomes. The vision outlined under race relations is for all Australians to understand and value Aboriginal and Torres Strait Islander and non-Indigenous cultures, rights and experiences, resulting in stronger relationships free from racism. These relationships must be based on trust and respect. Nairi, can you tell us a little bit about the ways that we're delivering on our commitment to race relations through this work?
Yeah, so beginning of this year, we arranged our first meeting, a gathering of our local elders, our Aboriginal and Torres Strait Islander community service and AMSs in the region to come and sit down and have a discussion and identify some of the key areas that need to be focused on in our region. So the outcome of that was amazing, because we seen that we were on the right spot and hitting the right targets, that trauma is a major area, poverty, housing shortage, poor education outcomes, a lack of employment, and focusing around youth mental health is something that the elders really identified. So this led on to feeding into more information and more depth into our Brisbane South PHN's need assessment, which hopefully will be out early next year, identifying the same information that our elders. So it's allowing us to focus on the areas that we need to be focusing on. So one of the things that we are identifying that our providers that we are currently funding are meeting these needs, but there's more work that needs to be done. So currently we have strong partnerships with the Institute of Urban Indigenous Health, Brisbane Aboriginal and Torres Strait Islander Community Controlled Health Service, Yulee Burrabah Aboriginal Control Community Health, Anala Wangara, Gumyameta and Galung Place. So they're currently working towards addressing our needs, but there's a lot more that we need to be focusing on.
Fantastic, and so amazing to have the generosity of all participants in an event like that to share their expertise. So fantastic. So the second dimension of reconciliation is equity and equality, that Aboriginal and Torres Strait Islander peoples participate equally in a range of life opportunities, and that the unique rights of Aboriginal and Torres Strait Islander peoples are recognised and upheld. We've long recognised the importance of self-determination to advance equitable care and to improve health outcomes, seeking out community leadership and guidance on the development and tendering process of our Commission programs, amongst other things. How else are we delivering on this dimension?
Well, from the outcome of the health needs assessment, we realised that we need to develop and support our mainstream providers and be able to provide them with more cultural support around how to work with Aboriginal and Torres Strait Islander people and how to understand what our needs are. So this is something that we will be focusing on. We're also working on building a stronger relationship with our community controlled organisations, and we're also looking at working with families and optimising our child development section. So it's very exciting on what our scope's going to be looking like in the new year.
Brilliant. And in our needs assessment, I know that there was some areas where people really identified a significant need, or where First Nations peoples were getting really disproportionately affected. What were those areas?
So chronic health is one area that's also been highlighted. So is youth mental health. That's been a big area that a lot of people, and early intervention is the major scope. Family and domestic violence is another area that we're also being identified, and so as early childhood. So like birthing in our community is another area that's been identified. So starting from that early age and that intervention and being there for families.
One of the things that really struck me when I joined Brisbane South PHN was just how our needs assessment that we conduct every 3 years underpins absolutely everything we do, and it guides all of our decisions really around how we prioritise investment and the design of the various programs and services that we provide for people. And what I've loved in particular around our First Nations work in this space has been that we go out to community, we listen, we understand what the needs are, what those pressing issues are, and then we're designing programs and services that aim to improve quality of health across every life stage, from birth through to old age. Are you able to take us through some of the programs that we've been engaged with this year that support First Nations peoples across every life stage?
Yes, Alice. So one of the programs that we have funded is Birthing in Our Community, and that was ran by Yulee Burrabah Medical Centre in the Redlands region. It had excellent outcomes because we saw more people attending appointments. We've seen smoking decrease, we've seen birth weights increase, and overall the feedback from the community as this is a positive program that they'd like to see. So with that, the region was able to secure federal funding, and now we're able to see it being rolled out across the region. So Brisbane AICS Medical Centre is also running the same program in the Logan region. So we're looking forward to seeing the great outcomes for our young ones coming up. So it's very exciting.
Absolutely, it's amazing to see such direct effects. Things like birth weight and smoking cessation is just amazing. And I gather that there's discussions underway about even longer term funding to continue that program through the Queensland Department of Health. So that's a really exciting time to have something that started small, proven itself, and then is ready for to be expanded to benefit other people as well. So obviously, access to good healthcare in the first years of life is crucial for improving health outcomes in adulthood. And we know there's an awful lot of complex and interlinked factors around that. But can you tell us a little bit about what we're doing for child and family health in this space?
So another program that we seed fund with Salvation Army, it was through Gunyametta, and they support families and children going to them, offering transport to their medical appointments, and also offering support for them as a whole. So giving that wraparound holistic support when the families are needing it, which is a great outcome, as most families at this time struggle with little things, and something where someone could offer some tiny support is a big benefit to our health. So they're doing an amazing job there as well.
Absolutely, and we've seen again from the evidence so far that something as seemingly simple as providing transport to health appointments is making a huge difference in helping people access the care that they need. And thinking about adult health, one of the big focuses that we've had this year has been around building the capacity of our health workforce to not just to identify but to respond appropriately to victims of domestic and family violence. And we know that First Nations people are 32 times more likely to be hospitalised due to family violence than non-First Nations people. We have a relatively new program called Recognise, Respond, Refer, and I know that there's been some work in that space around expanding that to benefit First Nations peoples, or to make sure that it's appropriate. Can you tell us a bit about that?
Yes, this is another amazing program that the community has come together, and it's a mixture of mainstream services and Aboriginal and Torres Strait Islander community control services. So it's the feedback has been amazing. So they're doing a combination of building the current workforce, and then also having the support and services for the people going through that who are experiencing family and domestic violence. What we're also seeing is how services can come together, and a person can have support from mainstream services and Aboriginal and Torres Strait Islander services, so that way they're getting both, which is fantastic to see that this is working. So that's working between Brisbane AICS and Newly Burrabah are working very strongly in that area, and employing a lot of amazing people to address this major area of priority.
And we know from, and thank you, we know from the evidence to date on that program that that's literally saving lives. So yes. It's so important, particularly with a community that's experiencing disproportionate disadvantage from this, that they're getting culturally safe care. And response, and that's a thread that sort of follows through to the next area that I was hoping to ask you about. This year we've also developed and launched the First Nations Health Focus website, which is at least from my perspective, in having a look at it, such an important new tool for the healthcare community. Can you tell us a bit about that?
Yes, so I am very excited because that was one of my projects. So I was very excited for this to come off this year. The website is designed to assist mainstream services to find appropriate Aboriginal and Torres Strait Islander services and programs in the region. And what we're seeing, yes, we've got Google and we've got everything else there, but at least this is our service specific for our region. And we've had amazing feedback from GPs saying how it's easier to operate. The other component that we have on there is actually being able to put information up for general practices and community to address the priority areas that we're requiring support. So we have a lot of information that's there for community and for GPs, and where they can refer and who's offering what services in the region, because a lot of people are not aware of the services that are out there, and this way GPs can easily print out, refer, and people can get assistance quite quickly. So I'm very excited about this project that's been completed.
Yeah, that for us at least, it feels like it's been a bit of a game changer for a GP or primary healthcare provider to just jump online to this website, search for the type of service that they need, and then point their patient to a service confident that it's going to be culturally safe and appropriate. That's been fantastic. So well done on getting that up and running. We've always been really excited to see how that model can work really effectively for our region. Thinking now about caring for our older people, this year Inala Wangara was one of the 5 community organisations awarded a service agreement to implement a new healthy ageing hub for their community. And this is part of a broader project. We're really keen to hear from you about what that means for in the First Nations context.
Yes, so it was very exciting, and I know that they've actually changed the scope of how to deliver it, because they were saying at the start that they wanted to deliver the information, but how do we do it interactively? So they were able to change their approach, which was amazing, and they've actually added in major different activities as well as providing information. So one of the positive things that they were doing out of the program was having smaller, so they've done line dancing, different arts and crafts activity. The most amazing thing out of it was seeing and hearing about a couple who met at one of their information little sessions, and then later on during the program, towards the end, they actually decided to get married. So they actually got married at one of their events. So I don't know if Carla actually thought she was doing a dating service, but it was a great aspect to see, a positive thing for our elders, and they're going away. They've had over 300 people go through the program, and they're blazing ahead. So congratulations on Inala Wangara and Carla and her team.
What a wonderful endorsement of how comfortable people are feeling in that space as well. That's somewhere they want to circle back to for such an important day. I gather that another really resounding endorsement of this program is that it's been gifted a traditional name, Belgae B'nai. Can you tell us about that?
Yes, Alice. Auntie Kerry Charlton named the program, and it means coming together to learn and uplift. So another amazing side of how they adapted the program.
Amazing. Yeah, absolutely. And I think it's really important for us to reflect as we talk today about how critically important it is to adapt these programs. That, there's no such thing as a one-size-fits-all for anybody, let alone for communities that have really particular needs and particular vulnerabilities and particular strengths. So it's amazing to see these programs being adapted and really supporting communities to flourish. As you can see, all of the work that we do to support First Nations peoples is informed, enabled and strengthened by the expertise, insights, energy and commitment of First Nations healthcare professionals. We are privileged to work alongside a strong and vibrant First Nations workforce in our region, and we wanted to take a moment to share and celebrate some of their stories. We hope that this video will also inspire and motivate the next generations of First Nations healthcare workers. We love being able to support these important journeys of personal and professional development, and we know that the whole region benefits from a strong and vibrant First Nations workforce. The third dimension of reconciliation is institutional integrity. All political, business and community institutions must actively support all dimensions of reconciliation. For our part, we're proud to be preparing our third Reconciliation Action Plan, RAP for short, which lays out the next 3 years of committed action towards reconciliation within our organisation. Nara, can you tell us about the RAP process?
Yes, so currently we are renewing our stretch RAP. So we're working within the Diversity and Inclusion Working Group as an organisation, establishing our actions that we'd like to see coming out of for the next 3 years, and we are hoping to have this completed by May next year, so that way we can start actioning all the amazing stuff that we're wanting to achieve. So at the moment, it's working within our all the departments and getting the key areas that we need to be focusing on. So our H&A health needs assessment is going to play a big part in this area, and obviously within my role on making sure we don't miss anything, and addressing all the needs that we need to be implementing. So I'm very excited and looking forward to the new stages of the RAP.
Amazing. And I know that Reconciliation Australia identifies 4 types of RAP organisations: is Reflect, Innovate, Stretch and Elevate. And this is our second Stretch RAP. And for us that means that it's focused on longer term strategies and on working towards really clearly defined measurable targets and goals. This is the second time we've done a Stretch RAP, and I know that in the first time round that level of accountability and transparency has been really beneficial for the organisation. You know, if you're not meeting your goals, then you've got to step up and explain why. And that's been a fantastic framework for us to strengthen what we're doing and embed this in our business as usual, and in our organisational culture.
Definitely, Alice, and it's been amazing to see that the organisations has been able to achieve this during COVID for the last 2 years. So it's been a great insight, and looking forward to the new direction.
So the 4th dimension of reconciliation is unity, and that's the vision here is that Aboriginal and Torres Strait Islander histories, cultures and rights are a valued and recognised part of a shared national identity, leading to national unity. This is achieved through the 5th and final dimension of historical acceptance, whereby we fully acknowledge our past through education and understanding. Nari, what have we been doing in this critically important space?
So we currently have an online module through Discover PHN that staff have been completing, which is called Your Mob, and it's a local developer from Anala that's created it. And what it does, it explains and gives opportunity for staff to understand the knowledge and history around Aboriginal and Torres Strait Islander people and how to work with Aboriginal and Torres Strait Islander people. So that's been a great program that we're offering. We've also, through our mental health team, have funded a gentleman that comes in and provides training, capacity building training for our service providers and Brisbane South PHN staff, which is also been amazing because he touches on how to communicate effectively, how to work with First Nations people and mainstream providers. He's also touched on the areas that we need to be exploring a bit more as a service provider to deliver services for Aboriginal and Torres Strait Islander people, and we've had amazing outcomes. So we're actually looking at hoping to be able to fund more opportunities in the future for our service providers and wider community to attend. Just don't know how he's going to fit it in, but we're hoping we can.
There's always too much work to do. And it's been such a privilege for me as the chair of our diversity and inclusion working group to see that diversity and inclusion framework that's been developed this year start to help to shape our organisational culture and our ways of working. And what underpins all of that, I think, whether it's our RAP or our broader work as well, is that we're genuinely committed to recognising and embracing all that makes us different and celebrating our diversity as a strength. So this brings us to the end of our discussion today. Nari, my huge thanks for sharing your insights on the varied ways that we're working to deliver equitable health outcomes for First Nations peoples in our region, using that framework of reconciliation, which gives it such meaning and such shape. Thank you also for your leadership, energy and drive in this space. There's so much more work to do, and this is a long-term journey to tackle centuries of inequity and inequality. But we remain deeply committed to supporting this critically important work. And thank you all for your individual and organisational efforts towards reconciliation in your everyday lives. We all have personal responsibility for addressing the systemic inequalities that exist to ensure a fair future for all Australians. Thank you.
Thank you very much, Nari, for sharing your work and the work that you and all the team here in Brisbane South Primary Health Network do towards improving the health of our First Nations community. It is truly very inspiring and important work. So look, that concludes the formalities for our 2021 AGM, and I want to particularly thank again our speakers, in particular Haylene, for your very well received and comprehensive overview of what's happening in Queensland Health with the health equity agenda. I want to thank Mike and the staff of Brisbane South Primary Health Network for their ongoing efforts. I want to thank my fellow board members. I want to thank our member organisations and all those of you in the community who've joined us this afternoon to share this story with you. Thank you very much, and please share the fact that this AGM will be available online for those who haven't been able to watch it today but would like to. So thank you and all the best over the Christmas and New Year period, and we look forward to working with you again in 2022. Thank you.